Hi, I'm Dr. Heather Bartlett. I'm a board-certified family medicine physician. And here's what you need to know about me. I take the practice of medicine very seriously. I take our Hippocratic Oath very seriously. I had the privilege of being born into a healthcare family. My dad was a doctor, my mom was a nurse, my sister's a nurse JD. I have numerous cousins that are also physicians and surgeons. You could say healthcare kind of ran in most of our blood. My background is I'm a Texas A&M University, College Station, Texas graduate, Bachelor's of Science in Biology. I'm telling you this because there's a sense of irony that I really hated biochemistry when I was in pre-med college days and in medical school, but it turns out it's pretty awesome in my current clinic. After graduating with my Bachelor's of Science in Biology, microbiology, biochemistry, it wasn't just something in medical school that I had exposure to. I went to St. Matthew's University in Grand Cayman. During those years of medical school, I actually had the privilege of also being taught by University of New England osteopath professors. So basically an accidental American medical experience in the United States while I was working on a master's in healthcare administration at St. Joseph's College in Maine. After I graduated from medical school, I had an internship in general surgery at the Jewish Hospital in Cincinnati, Ohio. I was a general surgery preliminary intern, meaning I had a one-year contract. At the end of that 1 year, I had to decide what I wanted to do next, and I elected to go into family medicine. Now, family medicine seemed to work well with my personality because there's a lot to know and there's a lot of exposure to a lot of things, and I enjoy that. I completed my family medicine residency as a chief resident at Mount Carmel in Columbus, Ohio, and that's how I got to Ohio. I thoroughly enjoy the outdoors, as you can somewhat see, and I thought that Seattle, Washington would be my forever home, so I took a job doing outpatient employed family medicine in Seattle. I quickly learned that the four walls of that office and the needs for people and what they wanted to change, it already was starting to take note in my brain that maybe things needed to be differently. I made the decision that I wanted to work back in the emergency room, and I moved back to Texas, and I decided I wanted to work at a higher acuity emergency room and took a job in Huntington, West Virginia. I decided I actually really miss Columbus, Ohio, and it needed to be possibly my forever home. And so I moved back here and took a job doing pre-admission testing. Again, more things I was learning of how medicine works and operates and exposures. And then also I moonlighted in urgent care, and then also took over as the lead physician in an urgent care at one of their busiest locations. I'm telling you all of this because I was already seeing somewhat the cracks in the healthcare system and people's dissatisfaction and how they felt and the words that they would use when they would come in and what they were hoping for, but it wasn't aligning with what they had been taught to how to interact with their doctor or to explain how they're feeling to get the outcome that they were hoping for. What do I mean by that? Well, people don't feel well a certain way, and sometimes people kind of lead physicians and say, well, it could be this, so I'm going to tell them, I'm going to use these words to see if maybe this is what's going on. Like this diagnosis. Maybe I have lupus. Maybe I have Crohn's. Maybe I'm depressed, and the symptoms that go along with it. Instead of saying very directly, you know, doc, because they weren't trained, this isn't their fault. I'm chronically exhausted. I have no idea why. I want to know why, and I want to know what to do about it. The what to do about it in our medical world means what to prescribe, not what to change in your lifestyle. So after working in the urgent care, and again, taking more mental notes, that's when I decided to open my direct primary care practice. That's where I got to really understand the need for aggressive lifestyle change. Only I couldn't implement it then because I wasn't offering the testing. I didn't have the picture of what needed to change. But those patients taught me how important this relationship is and just how much extra testing at a higher level needs to be done to get people the answers to the questions that they were asking. I had my direct primary care practice for about 4.5 years, and towards the last couple of years of it, had already started thinking there needs to be a different type of clinic. Now, knowing that a lot of people are struggling with metabolic syndrome and everything around that, or just chronic fatigue even, people who can't lose weight despite massive efforts. What I knew was I was researching different certifications, whether it was obesity medicine or functional medicine or anti-aging, longevity certifications, and none of them answered the call that I thought was appropriate for actually what people needed and what they wanted. They were all very formulaic. Some of them, even though they sound like they're an advanced certification, they may actually be circling you back to a basic allopathic medical practice. For example, this obesity medicine, it may be sending you eventually to a bariatric surgeon. That's not what most people are looking for. So after years of contemplating and researching and investigating what other tests are out there that answer the questions that I wanted to answer for my patients in that practice that I couldn't then, that's how this clinic was born. Now, it turns out that this clinic, before even Peter Attia had a lot of airwave time, was already doing a lot of the hallmarks of what he discusses. I would say the only differentiator is that our clinic is even more personalized than what a lot of Medicine 3.0 clinics are. I'm not in the game of BSing you and saying we do 1,000 biomarkers that I don't think are needle movers. We do the tests that other people call biomarkers, yes, but those are minute-to-minute tests. They're not as powerful as the other tests we offer because we actually look at cellular function, not just your complete blood count, whether you're dehydrated and your hematocrit looks high, you're making sure you're not anemic, or you're overhydrated and you look slightly low, your red blood cell count, okay? None of those games. We're looking at functional things. We want to know that you're safe, and we'll check those things, complete blood count, liver, thyroid, all that everybody's calling biomarkers. We'll do those, but we're going to go even higher level than that because that's actually where you move the needle and you know how your cells are functioning. So in 2021, I reopened my clinic and we started offering the MetaboLab Your Biohack services, which is a very unique set of testing. And even over time, since I've opened this clinic, an improved methodology for more success for people. I'm still board certified in family medicine. I just do things not necessarily differently. I'm applying the science that we learned, again, back in our pre-med days and in medical school, right before we started taking pharmacology classes, when we started learning the only way that we were able to fix things was either surgically or by a prescription. So I'm applying what we learned. That's it. I'm applying how our body works and trying to help people unravel the mystery of their body simply by utilizing biochemistry, thinking through cellular biology, understanding the importance of aggressive lifestyle change, and helping people move the needle truly towards a longevity and a good aging pathway rather than a little bit of smoke and mirrors, nothing but biomarkers that are minute-to-minute tests, or pitching nothing but a wall of supplements that are already pre-made that you may or may not need because you're not getting the right testing. So I wanted you to hear from me, who I am, what's my background, what's my testing, why I care about this type of medicine that we're doing, why and it has to be approached differently. Clients really have to be prepared, they have to be disciplined, and they also need to be willing to make aggressive lifestyle change if somebody has aggressive goals. I'm Dr. Heather Bartlett. It would be my honor to work with you. I just want you to know who I am. I think that that's fair.